All right. Hello, everybody. Welcome to our March Community Forum. Today, we're going to be talking story with someone from Queens we have on the call today, and I'm really excited to bring that forward. I'm back from vacation and ready for this session, so excited to get started. We are recording this session, so if anyone who's unable to join the live meeting, it will be posted on our LinkedIn and our YouTube channel, so you'll be able to see that as well. Let's kind of get started with today's agenda. As I mentioned, we will be talking story with a user from the Queens Medical Center. I do have some very important HHIE updates to cover, so I'm excited to kind of bring those forward, and then always we'll be ending with any questions that you guys, the team has. So just to introduce myself, I'm Clarissa. I am the Director of Provider Services with HHIE. I've kind of turned over the leaf. I had to edit my intro here. So I'm in 8 years now as a family nurse practitioner. That just took place last month. So I'm excited. I've been with HHIE for a year now. It seems like February is the month for all the things in Clarissa's life to happen. So I kind of ventured into this space in the health IT sector in the past year, and I'm super excited to bring my clinical experience as a family nurse practitioner. I did family practice in pediatrics. I do have acute care experience with urgent care settings as well, but I did med surg and ER as well, so as an RN. So I'm excited I love bringing that piece of what my background is to the clinical IT space. By helping with the trainings that I do. So if you've done trainings with me, I do run our CHR and Notify trainings. I do as well help with advancing interoperability through data sharing. I help with the validations of the records, looking at those to make sure they're complete and the viewing is looking the way it should be for you guys for coordination of care. I'm really excited to welcome our guest today, but first I'll turn it over to Jackie, who's the other half of my team, to introduce herself. I won't use your terminology. I'll let you use the way you like to introduce us.
Yes, yes. I'm Jackie. I'm with the provider services team. I am a little under the weather today, but it will not stop me from being here. And I'd like to say that Clarissa is the yin to my yang. I'm a speech therapist and I worked in geriatrics and acute care primarily. And then she did, outpatient pediatrics. So we kind of balance each other. And in that same vein, she does a lot of the client facing portion of our role here, and I kind of work on the back end to make things easier. So I do the password resets and getting people access to the systems, or if they have any issues going and figuring out what's going on. um, I will try to preserve my voice for later in the meeting, and so I'm going to pass it back to Clarissa to introduce our guest.
Yeah, so our guest today is Tan Young. She is with the Transitional Case Management team at Queens. I met Tan at a conference. I think our first one was the Big Island Symposium last year was where we first met, and I was so excited to meet her and hear about her background as a nurse in that space. And she has a lot of great experience, and her team utilizes the community health record portal as well as our Notify tool. So I was excited to kind of come in here today and talk story. So I'll let you introduce yourself, Tan.
Hi, everyone. My name is Tan Young. I'm a nurse. My role here at Queens is the operations manager for the transitional case management program. So really just focusing on the transition of care space, patients getting discharged from inpatient, ED, urgent cares. And prior to my Queens experience, I worked at United Healthcare as a health coordinator and Mahalo Health Center. Both of those roles, I was responsible for also supporting the patients in that transition of care space. And so being able to see, even in different roles and different types of continuum of care, it really is important that we make sure we have a good plan and support for patients transitioning.
Yeah, thanks so much. We're so excited to have you today. I think that, HHIE, the Community Health Record Portal, is probably the one that primarily our users are most familiar with. The Notify tool is a little newer. Can you kind of give us when did you first start it? When did your team or your experience with using HHIE, when did you start using the Community Health Record Community Health Record, as well as when did your team start using Notify?
Yeah, so I started using CHR about 10 years ago, just across various nursing roles. But our team currently has been using Notify for about 2 years. So we use both CHR and Notify on a daily basis.
Awesome. And just to kind of give background, I know a lot of our users are familiar with both tools, but the Community Health Record portal, it does allow you to search for a patient. So you don't have to necessarily have they do not have to be a part of your roster. So if you've got a patient you're trying to find records from past visits, you can just search their name and go in and see those records. Notify is a roster based and it's real time ADT notification feeds, and that's admission, discharge, and transfer. So you provide us with your patient roster, we upload that into the system, and then depending on your users, those users are notified in real time that an event has taken place, like a ER visit, an inpatient admission, an inpatient discharge. So that way in real time, so even at 2 o'clock in the morning, if a patient is seen in the ER, if they're a part of your roster, you will receive that alert notification letting you know that your patient was in the ER at 2 o'clock in the morning. But what's nice is it has that single sign-on portal that bridges you over to the community health record. So you not only see the event real time taking place, you also get the note. So you can see in real time those labs, those radiology reports. You can see that ER note. You can see the face sheet with contact info so you can get in contact with the patient. So it's really cool that this organization uses both of those tools. So I'm going to turn it over to Jackie. I think she had a question regarding Epic.
Yeah, definitely. So I know I used Epic for years, and it's probably one of the systems that I'm most familiar with. Queen also uses Epic, and one of the feedback that we hear is that, oh, Epic has everything in it, but we know that that's actually not the truth. And so I would love to hear how it is that the tools at HHIE really complements the work that you do using the EHR or Epic, I guess.
Mhm. Yeah, so our department follows patients beyond Queen's facilities. We have value-based contracts. And so we have contractual obligations to make sure that we follow up with patients, not only discharged from our facilities, but facilities all over the state. So we need to make sure we have visibility into, care received at any other hospitals or facilities. And as you all know, not all facilities share data through Epic's what we call Care Everywhere. So some only provide maybe like limited admission or discharge information. So what really helps is, when we don't get what we need in HHIE, we'll sign on to HHIE to make sure that we're able to see the full data from those facilities that aren't on Epic. And that really helps to fill in the gaps by giving us just beyond what we can see at Queens and in Care Everywhere. And the nice thing is also HHIE is embedded directly into our Epic. So with one click of the kind of HHIE icon, it takes us straight to the patient's chart. You just put in a quick 4-digit code. And instead of having to like search the patient, it takes us straight to the patient's HHIE profile. So no separate browser or login is needed. It's just been really efficient and nice to have.
Yeah, that's the IllumaCare ribbon. That is so
Yes.
nice. I love when I get to teach to the Queen system and to your users because they have that embedded link and it reduces the clicks, right? It reduces the amount of time that someone has to log into a portal. And currently, Queens is our only utilizers of that IllumaCare ribbon. So thanks for speaking to that because I think it really makes a difference. And, I think our first Talk Story session we highlighted an evidence-based practice review where it highlights that the most effective use of an HIE is when it's embedded in their workflow, embedded in their system, because it just reduces the amount of time that person has to use to go to another portal to log in. So super excited to hear that.
Exactly. Yeah,
One
it's
of
been a game changer.
Yes. one of the tools that we have within the community health record is a medication query. And one of like the testimonials that I hear them that really stands out to me and what really caught my attention was actually from a Queens provider, Dr. Koenig. And his testimonial was around the fact that our medication query changed the medication treatment that he decided to go with for a patient who they had a stroke. And so that patient needed TPA. And because he ran a medication query in our portal, he was able to see that the patient's anticoagulant therapy had changed 2 weeks prior to this. So he was able to change that TPA agent depending on that because he saw that in our query, and it wasn't in Epic. It wasn't in there as a medication change. So I think that our medication query is very robust. It's very, very great at providing that outlook. And the Queens Pharmacy is probably one of our most highly utilized tools. It's like they use our tool the most for that medication query. Do you have like any specific examples for your team, or just where the patient's medications have been helpful to your team?
Yeah, absolutely. I think there's probably a lot of examples from, our providers and pharmacists and nurses. But they do check HHIE, and one of the things is, not only to be able to see external medications, but to verify adherence. So you can actually see, what was ordered and also when the patient had picked up the medication. And so it's a lot more comprehensive and up to date. So that I think that's a huge component that our team uses to make sure that we're capturing the entire med list, and
Exactly.
that they're actually they said they pick it up, but did they really?
Yes.
So it's been really helpful.
And that's nice for your team because your team especially focuses on like an inpatient stay or an ER stay where that medication list could change, right? So you can see that discharge summary or that ER provider note where it shows that they've ordered a new med. You run a query and can see, I see that you picked up that med on this date. Did you start that medication? It says that you needed to stop this medication. Are you stopping it? You get to fill those gaps and have it right in front of you instead of being like, did you take that, metoprolol, or did you stop that metoprolol? It's like, which one is that one? What's that for? You get to see that, and it's so complete. And I love that workflow just kind of flows the way it should. Speaking about Notify. So Notify, this is a tool I'm super excited about. I run this tool. I took over this tool a few months ago. And I think as a clinician myself, if I had something like this in my hands, it would dramatically change. Probably wouldn't have felt like I needed to go outside of practice to expand my reach as much if I had control over my patients. But can you speak to how Notify works to like instantly provide your team visibility so that they can quickly act? Because we know that those scheduling follow-ups, making sure that the referrals are going through and getting those orders in place, whether it is for a referral, whether it's for a DME supply, like how Notify really helps your team.
It's been a really amazing tool. Let me walk you through like what we did before. So previously, because like I mentioned earlier, we have to follow up with patients also outside of Queens. And prior to being, notified of their admission or even being able to see their discharge summaries, we'd have to manually fax to those facilities to obtain the discharge summaries. And we also have to try and meet our measure by following up within 72 hours, and so it caused a lot of delays, but when we started to we had Notify, it was really essential to helping us meet our goal and completing the follow-up within 1 to 3 business days. And so, like you mentioned earlier, Clarissa, our team sends HHIE, our attribution list, so it's a list of patients. They upload into Notify, and then almost, pretty much in real time, allows us to be notified and filter through what we want to see. So I know there's a lot of different features in there. You could see, even outpatient visits, I believe. But for our program, we really focus on, ED discharges, hospital discharges, and we can filter those certain dates. Let's say it was a holiday, we didn't get to cover that patients on those days. We can filter to those days so that we can make sure that patient gets assigned to a nurse for follow-up. Yeah, it's been amazing. I think that instead of having to just log into the CHR to look at each patient individually, it's nice to be able to have that list of patients and notify, and just a lot more efficient. So I think for our staff, for our providers, I think our payers were really happy to hear that this, that we invested in this, but just huge satisfier and value add to the process and program. And another thing I wanted to mention is our payers actually, each one has kind of their own, because they're the payer, right? They have the ability to see when claims come in, but sometimes claims are delayed. It's not always, immediate. But the other thing is that if we have, let's say, 7 payers, we would have to log in to 7 different platforms to attain these records of, external facilities. And again, totally inefficient. You have to memorize all of those different logins. It's yeah. And so being able to have this capability on one platform is amazing.
That's awesome to hear. I love how you walked us through your workflow and really how it touches all of those different points. And I actually have a question regarding the measures you were talking about, meeting those measures, the preventing 30-day hospital readmissions and things of that nature. So I'll talk to that in just a minute, but I think Jackie has some questions about Hawaii's unique clinical landscape.
I do have questions about that, but there's a question in the chat that I'm going to bring up real quick.
Okay.
Going back to my previous question about CHR and Epic, and is there stuff that you find in CHR that's not available in Care Everywhere, like specifically outside of the med queries? But yeah, that was a question asked.
Yeah, so certain facilities
from Epic organizations, actually, specific now. Yeah.
Yeah, so certain facilities will only, like I said, put in the admission date and the discharge date with a diagnosis. It doesn't provide us any other information. We don't know the med list. We hate doing cold calls. Nobody likes them. We reach them, how are you doing? Like, are you taking, read out the medication. It's not meaningful when we have to do that. We don't like that. And so I think, even though, it feeds into Epic, some of these facilities, we don't get all the details.
Right.
So it's not as helpful.
Yeah. And Jackie has firsthand experience with that too, with Halinani. And the fact that you think that you get that care everywhere, you have access to everything, but it really is that organization's discrepancy on what they share within Care Everywhere. So just like what you're speaking to, where another facility who uses Epic, that doesn't mean that you get access to all of the clinical notes that they have. So yeah, thanks for expanding that. And I'll let you take it over, Jackie.
Yeah. We're running out of time here, so I'm just going to kick back to what we were previously talking about. And Hawaii is so unique in the sense that we've got the outer island transfers or people coming, to Oahu for care, or if they've got limited specialty services on their islands. How does your team stay connected to a patient's full story when you're using HHIE?
Yeah, so our team follows patients statewide. And again, not just Queens, outside of Queens as well, because of our network. Our providers are not just with Queens as well, they're PCPs, specialists. We have community-based providers that are within our ACO. And so in order to support these clinics and patients effectively, we need to access these care notes and encounters across multiple health systems. And I think that along with Epic and HHIE really allows us to have a better visibility into understanding the full picture, regardless of where a patient gets care.
Yeah. And then I'm going to end with a little bit of a heavy hitter. We've talked about that found in HHIE and that's been valuable for you, but is there anything that you're hoping to see from us in the future that would make it even better?
So I can think of a few things. I think we mentioned this earlier. The readmission and utilization data. I think for internally, I can only get readmission data for patients that are within Queens, and you guys actually have way more, I think, data in terms of where the patient has been. What's the utilization, and so I would love to be able to see, like, per patient individually, what is their readmission utilization data look like? So I think that would be one opportunity that I think a lot of providers would be interested in. And for me, I don't fully understand why there's like multiple charts. I'm sure you guys have mentioned it before, but I always wonder, like, when I go into the patient's, CHR, there's usually maybe sometimes one, but sometimes 3 or 4 that I need to choose from, depending like on which facility. And so, I'm wondering if there's no issues with it, that like consolidating it into one chart would be easier to navigate for users without having to like go back and open the other option, I guess.
Yeah, that is, both of those are both instances that we kind of keep in that background. The first one, the utilization reports, it's more like a report or maybe even like a dashboard that HHIE is definitely keeping on the forefront of the technical upgrades that we are hoping to do in the future to our platform that will incorporate some of those highly sought after dashboards that show like ER admission rates, or maybe they'll show, for our private practices, we can show things like preventative care measures. So that way they can identify trends in A1Cs, or they can identify right off the bat through a dashboard what the user needs, right? And so love that that's definitely, and I love the little less than 30. I'm sure you've seen that on some patients. In the community health record, if you're in a chart and that patient has had a readmission within 30 days of a previous inpatient discharge, which is a big red flag, right? That's a big readmission. Preventing 30-day readmissions is a huge a big thing that we try to prevent. We don't want people to have to get back into an inpatient setting if they just were discharged within 30 days. So in the community health record, if that has taken place on a patient, there's a red flag that shows up at the top and it says less than 30. And that indicates that that patient has had a hospital readmission. And so you're right, we do have that data. And so it would be awesome to be able to pull that forward for you in a patient by patient basis to show those in a dashboard setting. So love that input. I also love what you're talking about is patient matching. We use an EMPI that helps to catch those issues with that patient matching. But I do stress this in trainings, and I love that you brought this up, is HHIE is a data repository. And so the last thing we want to do is when we receive that data in, we don't want to pull records together and pull them into one if we can't guarantee that it's the same patient. And so our system does a great job at, if it meets 95% or greater, we'll merge all that data into one encounter. But if it doesn't, whether that means the phone number is different, the address is different, the name is spelled differently, because we love our hyphens and the Okinas and they're awesome, but they can sometimes be, one facility has it listed with the hyphen, this one doesn't. All of that makes a difference in how that name, whether or not it gets pulled into being one record. So I love that you mentioned that, and that is something we are constantly working on, is improving our patient matching. We are running out of time. We talked story a lot, and this was awesome. I think we touched on just about everything I wanted to touch on. Thank you so much, Ton. I'll kind of leave it open for the next couple minutes to see if there's any questions from those attending. And then too, after this, you're feel free to reach out to us to answer any questions you have. But just to kind of give you some updates. So one of our newest advancements, you've probably seen on our LinkedIn, it was also on our newsletter, is that we now have telemedicine notes from the Queen's Health System. And now with our ADT feeds, previously, when you saw an ADT in a face sheet from Queen's, you were not seeing ICD-10 codes, but now you are. So those ICD-10 codes are showing up now from Queen's, which is awesome. It helps to see it in the Encounters tab. You can also see it in the face sheets, and that's visit by visit. So you're seeing the ICD-10 codes related to what that specific visit was about. Very awesome to see that in our system. It was a big gap in the quality measure. So awesome to see that, as well as improving continuity of care for the virtual visits, which is amazing for the outer islands, for what Jackie was talking about, patients going for referrals and coming back, or emergency, because we know, like Queen's Neuroscience, they use the telemedicine a lot for stroke patients to identify who needs to be transferred, who doesn't. And so that is super important for not only them to see those, but also when the patient goes back home, for that provider to see, their primary care provider to see what took place during those encounters. Our annual account audit is in progress. So if you are on this call or you're watching and you are a point of contact, please keep in mind that if you log on to your RegPass portal, you may see a little flag at the top that says, please verify the account. So please go in, take a look at that and verify your account to make sure your users are accurate. Jackie, any plugs there? I'll quickly see if you have any questions. You want to add any color to that one?
On the audit, no, I think we've been getting a lot of good responses. So thank you to those that have actually done it. This is something we do every single year. So it just really helps us keep in compliance and making sure that the right people have the right access to the information, because we are a data repository. We're dealing with PHI. And so we want to keep that protected. So it is an important piece of our regulations.
Awesome. And then one of the biggest, so Hilo Medical Center, Hilo Biniop, they transferred to Epic back in November. And since then, we were having issues with their data connection. I'm happy to report that that is back up and live. I think a bunch of our users, especially our Notify users, they received a whole bunch of ADTs that came through that were older ADTs, because we replayed all of that data. So even we went live again, I think February 14th. And so it was turned on and good to go. And what our team even did is they said, you know what, we're going to replay that data. And so all of that data from November 1st go live up until that February 14th, we actually were able to get that data also back into the system. So really excited to see that. That one's a really big asset to our Big Island users. So excited to have that back into the CHR. We're kind of working through some little things that need to be improved, but that's what we're here for, on the provider services team, to help improve with that, the way that's displayed in the system. Kahuku Medical Center, they went live with Epic, and that data connection is up and running. You can see that clinical data. If you've got a patient coming from Kahuku, you can see it in the Documents tab. All you have to do is hit that Find External Documents button. Again, just a little plug for my training. If you do not know what that means, then you need a refresher training with me. And then we also expanded access to the military treatment facility notes. So one of the biggest issues is that tripler notes, they did not include the date. You had this like DOD VA note and that was it. Now, when you see that, you're able to see it says specifically tripler, and the date of the encounter shows up. Huge win there. And it is all military treatment facilities. So you're able to access those through that area. Thank you guys so much. I don't see that we have any new questions in the chat, so we'll kind of close out here. Just want to say thank you so much to Ton for joining us today. Our contact information is in as well here if you need any help with retrainings or new trainings, or you're interested in HHIE signing up. That our information's there. You can reach out to myself or Dr. Burton, who also decided she was going to join us today and ask a whole bunch of questions. So we love it. And then just a kind of little plug too, one of the things we're hoping to do is expand in our data sharing this year. We really want to capture that rural health population and help to onboard new data participants to share data, but also to use HHIE. So if you're interested in that, you see rural patients, or you have any interest in you provide care in a rural setting, let us know. And if you are interested in Kuakini data, that is a big one for us here on Oahu. If your organization needs the Kuakini medical records in order for care, and it's a big gap that we currently can fill, contact me, reach out to me through my email below, and we'll this is just a little plug for some community assistance. So reach out. But thank you so much, Ton. Thank you for your time. Again, this will be on our YouTube channel and our LinkedIn for those who wanted to join but wasn't able to.
Thank you. Thanks for having me.
Thanks, everybody. Bye.